All right. Hello, everybody. I know some people are jumping in. Hello, hello. Thank you for being here. Welcome to if you are watching this live, our July parent webinar series. So, this is our free parent webinar. Welcome. We are Guiding Bright Minds. If this is your first time, I'm so excited that you found us. Guiding Bright Minds is a free online resource for parents of neurodivergent children, grown adults. It's also for caregivers and really anybody that identifies with neurodiversity or neurodivergence. I'm Eve Boyd. I am the community ambassador. So I work alongside the lovely, the one and only Tiffany Feingold. And today I'm personally really excited about this topic. And we'll get into kind of why we all are very kind of passionate about this topic. So today we're going to talk about the common misconceptions about ABA and what every parent should know. And realistically, it should probably be more what every person should know, or at least be aware of, because there's a lot of misconceptions. I'm sure we've heard that as professionals. I'll be interested in hearing from a lot of you who are attending this today. Do you have a positive or negative experience with that? And so today is all just really about education around this. And so what we wanted to do here at Guiding Bright Minds is we wanted to bring in some of the providers that are within our network who we've been working with for a long time. We've known, trusted, believe in. I mean, these organizations lead with integrity, with science, with intelligence. So we're so excited to have a variety of perspectives here today. So just a couple quick house cleaning things, housekeeping, I guess, house cleaning. I guess that's subconscious for my house. So how today is going to go, we're going to do some introductions. We're going to start off with just kind of definitions, right? So what is ABA? What are some of these myths that we've commonly heard and maybe some that you have heard? And then we're going to go through some really difficult questions because, I've spoken to people who literally, think that ABA is the worst thing ever. And I want to have those conversations, right? I want to listen to those voices. I want to hear the royal we want to hear about that. Because like we know, we may have one negative or positive experience with one thing at one place. It doesn't always have to be that way elsewhere. So we're going to go through all those different aspects. You are free anytime you wish to ask a question in the Q&A or in the comments. So if there is anything specific that you want to ask one of our panelists, feel free to do so. I can answer those, especially if they're relevant or specific. I can answer those in the moment. And then, of course, at the very end, like usual, we will have a Q&A. Many families, I just kind of want to say many families are really exploring autism services and they have questions about ABA, which stands for Applied Behavioral Analysis, which we'll talk about. Like I said, some have success stories and other have concerns, other want information, other may find it difficult to know what to do or what to believe. And so today, in order to kind of break those down, we have brought in Achieve ABA Therapy Group. We have Behavioral Innovations here with us. We have Handprint Therapies and Allure Behavioral Health. And so after this webinar, I'm sure these wonderful humans are going to be talking about different resources. So just know that I will be taking notes as we're going through, that if there is anything that they state, we will send this out on the back end of this recording. And then if you're watching this on YouTube or on a video, it will be below in the description. I will put those resources. So kind of what I was alluding to before, today's goal isn't to convince you that ABA is the right choice. That truly our goal is just to provide a balanced, transparent information so you can make informed decisions for you and your family. So I want to come back to our panelists and I want to start with, so we have Achieve ABA Therapy Group here with us. We have Maddie here. So hello, Maddie. Do you want to just take a quick moment and say, you can tell us about your organization, who do you typically serve, and what's one thing that parents often misunderstand about ABA?
Absolutely. Thank you, Eve, and thank you, Tiffany, and Guiding Bright Minds for being just like the most fantastic resource for neurodivergence in the Front Range. We just love you guys. So my name's Maddie Vigilik. I'm the Director of Community Outreach for Achieve ABA. We are an in-home and in-community therapy group and can work in schools in certain situations. We serve all over Colorado, but primarily the Front Range from Colorado Springs, wrapping all the way around to Fort Collins. We serve children 2 to 21 years old and accept all major insurances for the most part, including Medicaid. So there's my little Achieve spiel. We're thrilled to be a part of this discussion today to help answer these questions and even answer the difficult questions. And as an educator, I've personally had experiences with ABA groups and know the goods and the bads, right? And really want families to find the service that is the best fit for their family. One common misconception that I wanted to bring up is that ABA is kind of glorified babysitting, and it can be 40 hours a week of babysitting. And ABA is, I think that families are most surprised by that number of hours, and then it turns into that this is childcare and not a service. And it can sound kind of overwhelming and that this is like a full-time job and then this is like your child's childcare provider. And it really is a service that we all work together to complete the whole child and service these behaviors so that the family can just beautifully live and love each other.
I love that. I love that. Yes, exactly. Because I originally, when I was introduced to ABA, I thought it was like 40 hours. And I know we talked about that. Like, this is a job. So yes, so I'm looking forward to learning a little bit more about that piece and what it can look like. Next, we have Betsy Hart of Handprint Therapies. Hello, Betsy.
Hello, Eve. Thank you. Another shout out to you and Tiffany and Guiding Bright Minds and just everything you do. I love being part of this webinar because it is focused on knowledge sharing and questions and supporting. And I thank you for hosting this. And so I'm Betsy Hart. I am the CEO and founder of Handprints Therapies. I'm also an OT by trade. And I founded Handprints Therapies in 2002. So I've been around for a long time, providing clinic-based services. We have a clinic in Lakewood and also in Greenwood Village. And we primarily serve kiddos ages 2 to 10, 11, 12, providing that interdisciplinary approach in a clinic, the ABA, speech, PT, and OT. We also have an outpatient program under the same roof where we're providing outpatient speech, PT, and OT separately for kiddos 0 to 15. And we also, under that umbrella, have Handprints Academy, which is a specialized day program, also known as a facility school. So we really can serve kiddos who need that special support in an academy school-based setting with special ed directors and IEPs and all of that support. So that's a little bit about us. And I want to go into another misconception. Mine is that ABA is most beneficial for kiddos that have significant support needs. So ABA can actually benefit children across lots of different ranges of abilities. So if we think about anything at all that could interfere with success at home or in the school or in the community, ABA can really support with that. So think about emotional regulation, executive functioning, social relationships, flexible thinking, independence, and the list goes on. And if I can give a couple of quick examples, I love examples because it really helps us hone in. So think about a child who desperately wants to make friends. They struggle with those social cues. They struggle with the reciprocal conversations and reading the room, taking turns, listening, pivoting topics. These kiddos could really benefit from ABA and practicing the skills associated with interacting with peers with some guidance that's not necessarily from mom and from dad. So ABA can really support with that. Another example is think about a child who does have lots of friends. They are really looking very successful and high level on the outside. However, sometimes they may become super overwhelmed with transitions, or they may have some sensory challenges, or unexpected changes in routine can really cause some disruption and some meltdowns. So ABA, what I love is that ABA has that time with these kiddos that they can observe the patterns. We can recognize those early signs of dysregulation and then coach kiddos through those challenging moments, which is unlike OT. So I said earlier, I'm an OT by background. OT is wonderful with sensory. We love to do the vestibular proprioceptive input, all the sensory pieces. However, when we think about OT, we get to see these kiddos for 1 hour a week. So we oftentimes miss the antecedents or what comes before the meltdown. So that's where I feel like ABA can really shine and support these kiddos. So there
That's
we go.
great.
That's my spot.
That's great. I love it. Yes, in the moment. In the moment. That is key. Thank you so much. Okay, now we have Allure Behavioral Health. So we have with us Alden and Romina. Hello.
Hello. I'm going to have to also say thank you to Eve and Tiffany and Guiding Bright Minds for bringing this event together. I always love to talk about ABA and I do for a living. I've been in the field for almost 20 years, but I've been with Alora for almost a year. Alora is an organization that's been around since 1983, started out in California and recently expanding to Denver, Utah, and Arizona. Alora really believes that the child and the individual are unique. We really want to make sure that we get the most information from the caregivers so that we can create a plan that is truly made for them. We provide care in the home, in school, and in the community as well. And we also are going to try to go into schools. I believe that schools need our support and our kiddos need our support in the school. It is new to Colorado, but that's something that's been going on in California for a while. So it's something that's new. Families are not really aware that we are allowed to go into the school. There was a law that passed about 2 years ago. So that's always, I like to always inform families that it is now allowed for us to be in the school. One of the misconception I personally feel super motivated by is that ABA is abusive or that ABA is dog training. A little bit about me, I started off in 2006 and we did use a lot of procedures that would no longer be something that we would do now. So I do understand that there's a past experience, there's a past history about the field. So I don't want to diminish that, but I also want to make sure that when I'm talking about that specific misconception, that I talk about how far along we've come. The field is really moving towards compassionate care, trauma-free ABA. When you're looking into a provider, those are definitely questions that you want to ask about, like which procedures do you utilize? What are your takes on assent and assent withdrawal? And the misconception about it being dog training. The history of ABA, like any science, has utilized animals, but we didn't only use dogs. I had a professor that was obsessed with pigeons. So I learned about how it was applied to pigeons and guiding missiles into war. So we've been around for a long time, utilized in different ways. So I think the quality depends on the provider. I think that if you have a provider that's like, we're going to give an M&M for every response, that's a red flag. And I think that's something that we'll talk about later on as well. But definitely making sure that you're asking a lot of questions about with the provider that you're deciding to pick. That's all.
That's awesome. Wow, I'm learning too as we go. Thank you, Romina.
Of course.
And last but not least, we have, which I will circle back around to Achieve because I know we have two representatives from that. But we have Behavioral Innovations here. So we have Nicole and Stephanie with us.
Hi, hello. Yes, Nicole and I are both area clinical directors with our Colorado location for Behavioral Innovations. We are a company that provides early intervention, center-based early intervention, ABA across multiple states, Texas, Oklahoma, Colorado, West Virginia, North Carolina. The company also started in the early 2000s and really is focusing on sort of preschool aged early intervention skills, but we do intake up to age 10, and we also have a really strong social skills program as well. I've been in the field since 2006, and Nicole's been in the field since 2017, and we're just really excited to dispel some of these myths.
Yay.
And one common misconception we wanted to address right off the bat is something that definitely comes up a lot with parents, especially families who are newer to ABA. There's a concern that ABA's goal is to make the child neurotypical, or that after ABA, they're going to get these skills that make them seem robotic or, not authentic. And that is absolutely not the case. We practice assent-based therapy as well as child-led therapy, meaning that everything is within the realm of what the child is interested in and what they give us assent to work on with them. Ultimately, we're not trying to change who they are or change their personalities to try and make them fit in. We really want to help them grow as a person and as a unique individual as they are, and help them to build skills that will help them later on. ABA previously was known to be working on things like fixated interest or stimming, and that really is not something that we target anymore. Every kid has their own special interests, their own skill set, their own unique strengths, and we really aim to foster that and help them grow and find ways to connect with others given their own unique skill set, rather than change them or try and make them fit in.
Love that. Love that, right? Because that's real life. That's real life. Wonderful. And then I just wanted to come back around to Israel and Jasmine. So I know you're with the Achieve ABA Therapy Group. Just wanted to say hello, see if you wanted to introduce yourselves very briefly.
Yeah, sure. Thank you, Eve, so much. So I am Jasmine. I am a BCBA with Achieve ABA Therapy Group. I've been a BCBA for almost 7 years now. I've been in the field since 2014. And so a lot of the misconceptions that we've already spoken about, I have seen as well. And so I'm just glad that ABA is, innovating, is becoming more compassionate based, assent based, trauma informed. And so I'm really excited for this panel.
Awesome. Thank you for being here. And then is Israel still here? No worries. We'll just keep going. Well, hello, wherever you are. So jumping in, thank you so much, everybody. So kind of jumping in about, we've already started to scratch the surface of this and Achieve, we ended with you. So we're going to come back. What, this first kind of section, so that way we're all starting off on the same page. What is ABA really? What is ABA? What are families often surprised to learn? What goals can ABA address besides behavior? So I'd really like to start us out there.
Hi again, it's me. I'll be answering that question. So ABA, a lot of people believe ABA is a one-stop shop, right? ABA is a complementary therapy, right? Because we are meant to complement all the other services a child or an individual may have. And so ABA, like Eve has said that it stands for Applied Behavior Analysis. At its core, it's the science of understanding. So like what a person is doing, what they may be communicating through their behavior, what is happening before and after the behavior, what skills or environmental changes can improve their quality of life. So that's like our ultimate goal, just to improve the quality of life, right? And so we have said before that the goal should never be to make the child or individual appear less autistic or simply more, neurotypical, right? That's not our goal. ABA focuses on communication, independence, safety, self-advocacy, emotional and sensory needs to a certain extent, because we leave those to the experts in any sensory needs, which is the occupational therapist, right? Access to meaningful relationships and activities. So We also prioritize assent. Assent is really important in our field right now. And so we pay attention to whether a child is willingly participating and respond to verbal and nonverbal signs of discomfort, withdrawal, or refusal. Our job is mainly to have fun, and to be a reinforcer basically for these individuals, because we don't want to be something that is very aversive, right? And so some examples, to discuss like in what is ABA. So like consider a child who does not yet have a reliable way to communicate. And we get a lot of, the younger children, they don't have a reliable way to communicate. And so the child may cry, they may hit, they may drop to the floor or pull an adult towards something because, excuse me, those are currently the most effective tools they have available to them, right? That's how they're communicating. And so we don't approach that child, in this example, as someone that needs to be, and I say this in quotes because I hear this all the time from parents, that they need to be fixed, right? That's not our approach. So we ask, what is the child trying to communicate? Are they asking for help, a break, attention, space, or access to something? How can we give them a safer and more effective way to express that need instead of, hitting or dropping to the floor? And so communication methods might involve, because people communicate differently. So spoken language, sign language, gestures, pictures, an AAC device, right? It could be whatever, an iPad is a really common thing we see right now with the AAC device. AAC devices can be any type of, communication method, right? That is outside of the spoken language, sign language, right? All those good things. So as a child develops a reliable way to communicate, behaviors that previously served that purpose. So all those maladaptive behaviors that, I say this in quotes, bad behaviors, right, that we may see may decrease because the child no longer has to rely on them as often because they're like, oh, wait, this works. And it's, I don't have to engage in all this. I can just say I need help or I want this cookie. I want whatever it is, right? So the principles of learning may be consistent, but the treatment plan should never be a one size fits all, right? It's very individualized according to the individual. No child is ever the same. I know I've heard parents say before, well, my child doesn't do that, or my child does that. Every child is different. No child is the same. So things are going to be very individualized. And so every program should reflect the child's needs, strengths, preferences, culture, communication style, and family priorities. And so ABA, like kind of in summary, right? So ABA should not be about changing who that individual is, changing who the child is. It should be about giving them more ways to communicate, advocate for themselves, and participate in the life that they want.
Awesome. And then from your perspective, what does a typical ABA session look like? And I know it's what I'm kind of gathering is that it's very individualized. And I think you guys, what ages do you work with again? Remind me.
We work ages 2 to 21, I believe.
Okay, perfect.
Yes.
So obviously every session can look different, but what
Yes.
does like a typical ABA session for those who are curious look like?
So I'm going to describe it just because we have seen a lot of younger children in these intakes, right? So I'm going to use like a younger child as an example, right? So a technician, the RBT may begin by joining the child in the activity that they're already enjoying. Like I may come in as a BCBA too, right? And I see what the child is doing, and if they're playing with dolls, I'm going to be joining them in, right? I'm going to do that pre-session pairing, that just making sure that like I'm joining in. I'm not there and they're like, oh, now I have to stop playing, right? And so the RBT may sit on the floor, play with the toys, draw, build blocks, or talk about the child's interests, right? If they're at that level to communicate, right? So this relationship building process is often, like I said, is called pairing. And so pairing is not wasted time. It helps establish trust, safety, connection, motivation to participate. And the RBT also observes the child's mood, energy level, sensory needs, and willingness to engage. And so we're trying to see like how is this session going to be, right? Because the child may be feeling a little unwell. And so we're not going to present all of these different things for them to tire them out even more, right? And so like learning, we use learning through natural routine. So goals are often embedded in these activities that are already happening, right? So reaching for a truck becomes an opportunity to practice requesting. Snack time becomes an opportunity to make choices or use the AC device that they were prescribed. Getting ready for the part becomes an opportunity to practice dressing or follow a routine, or playing a game becomes an opportunity to practice turn taking, waiting, or coping with an unexpected outcome. That happens a lot, right? A difficult task becomes an opportunity to request help or a break. So the goal is not to withhold everything the child is enjoying until they perform, right? The goal is to create a more natural, respectful opportunities to practice useful skills that occur in their everyday lives. So an important topic is assent right now. So assent, the child should have meaningful choices, right? And so the provider, the RBT, should monitor verbal and nonverbal communication throughout the session. So signs that the child may be withdrawing assent, right? So what I mean by that is like they're not willing to engage with you right now. So saying no, pushing materials away, leaving the area, becoming unusually quiet, turning away. It's different for every child, every individual, right? And so these behaviors should be treated as information during the session. And so the RBT may pause, offer a break, reduce the difficulty, change the activity, provide another communication option, adjust the environment, or rebuild motivation before trying again. And so this is all embedded in each session. And I know Romina spoke about like how ABA used to be, and this is the ABA we're seeing right now. We're being more compassionate, asset-based, and making sure that we're complementing the services that they're receiving. We're being very fun. We're being very child-led. We're being just, someone very pleasant to have right next to them, basically.
That's great. Thank you for sharing that. Awesome. All right. Well, moving along, going to the next section, the common misconceptions. So, Nicole and Stephanie, I'm going to have us walk through that. So, with behavioral innovations, one of the first myths that we were all talking about is how ABA tries to make children act less autistic. So, I wanted us to start on that one.
Absolutely. Yeah. So that is something we definitely hear a lot. And I would agree that it is rooted in sort of old school ABA, right? So I did start in 2006, and the approach that, my superiors and mentors were using was definitely like, we want to make sure kids are able to fit in. And the goal a lot of times was to teach kiddos to behave in ways that their peers would accept. And we, along the way, learned that rather than teaching kids to look less autistic, we can teach other kids to just be more accepting of differences, right? So that was a pretty big paradigm shift. And I would say any good quality ABA provider is going to be really rooted in what I consider to be like radical autism acceptance, right? Like we understand that kids on the spectrum have unique interests and they have unique ways of coping with things. And as long as they're not hurting themselves or hurting someone else, it's okay to, engage in a behavior that might look a little bit different. So really, behavioral innovations approach is we look at the kid as a whole, and we make sure that we are encouraging the behaviors that make them who they are, but we're also building skills to give them the opportunity to be as independent in the future. And again, if there's a behavior that's harmful to them, or is going to preclude them from safely experiencing a community goal or existing in a group setting for learning, those are things we would target for a reduction in terms of behavior. But again, the ethos behind what we do is autism acceptance, skill building for independence, and ensuring that kids have the opportunity to safely exist in group settings.
Fantastic. I'm going to have you answer this, or others can chime in too. But we have a question about wanting to hear more about the assent model. So that's been referenced a few times.
Absolutely.
If you can quickly just kind of speak about
assent really is the idea. So we all kind of know what consent is, right? So when we think about signing consent forms, or if someone asks you, do you want to do this? You can say yes or no. So that's what consent looks like. Assent really is the next step of, for our individuals who maybe don't have the ability to say yes or no, they are showing us the signs that they are willing to participate even without that verbal yes or no.
Awesome. Perfect. So if there's any follow-up questions to that, definitely put it in the chat, Alicia. Okay, so our myth number 2 that we want to be debunk: ABA stops children from stimming.
So this one also fits into what Stephanie touched on as well, on that we're not, changing behaviors just for the sake of making a kid appear more neurotypical. In fact, stimming for a lot of the clients that we work with serves a purpose for them. It's a way for them to express excitement, happiness, engagement with an activity or person that they really enjoy. It can also be a way for a child to self-regulate or self-soothe in situations that may be overwhelming or overstimulating to them. Really, the only time that we would even look at stimming is, as Stephanie touched on, if it was something dangerous or potentially harmful, or if it's impacting their ability to access learning in a particular setting. But ultimately, stimming is not something that we view as a negative. It's something that is, like I mentioned, serving a purpose for each child. So making sure we understand what purpose is that stimming serving. And again, helping other kids in the community, whether that be family members, siblings, kids in the class, be able to recognize when another kiddo is stimming and kind of take away some of their fear or questions or confusion about that, to make it something that is more normalized for them.
It's great. Definitely debunking that. So yeah, definitely not about stopping children from stimming. I love it. Okay. And then what about a common one, and something that I shared with the panelists when we were preparing for this? We've gotten a lot of negative feedback about promoting ABA or supporting organizations that utilize ABA. And this myth, I feel, is very relevant, that ABA is punishment based. Tell us a little bit about that.
Yeah. So, I mean, I think I understand why people are concerned about that, right? So ABA is the application of the science of behavior. So to kind of zoom out a bit, when we're thinking about behavior, a reinforcer will increase the future frequency of a behavior, and a punishing experience will decrease the future frequency of a behavior. And that's the case for every organism, right? That's the case for neurotypical adults. That's the case for folks on the spectrum. That's the case for birds and animals. All organisms follow these rules of behavior. So it is confusing because the science of behavior does recognize that punishment has the ability to reduce a problem behavior. That said, it is not ethical for us to use a punishment procedure when building skills, and certainly when it comes to reducing behaviors that are harmful or dangerous. We have years and years of research demonstrating that reinforcement procedures can effectively reduce dangerous behaviors. So again, zooming out, yes, ABA is the application of the science of behavior, and that science does recognize consequence strategies as reinforcement and punishment. However, high quality ABA providers are not using punishment procedures to change behavior.
I like that. And I think that's that's the distinction, right? Like the provider. And I that's kind of this common denominator I'm getting, like a good provider, a quality provider. So yes, I'm hearing this loud and clear, that these are definitely red flags. And thank you, Nicole, for answering the individual who asked about those red flags as well. So one that I had this misconception for a while, that ABA is only for younger kiddos. So tell us a little bit about how that looks like through maybe the lifespan or for adults.
ABA can serve really a wide variety of individuals. I would say the one that people are probably most familiar with is what we call early intervention. That's something that is definitely recommended for families. So if you are able to secure a diagnosis at a younger age, research does indicate that early intervention is very effective. However, ABA does not stop at early intervention. When a kiddo turns a certain age, we don't automatically pull out. In fact, we adjust our treatment plan based on the changing needs of the kiddo. Sometimes you may even see that a child who participates in early intervention, graduates from services, maybe starts attending school, will revisit ABA in the future in, say, middle school or high school when some of the social expectations change or the day-to-day needs for a child may change as they get older. So it really is something that can support a child through many different phases of life, but there really is no wrong time to start ABA.
That's great. That's great. Yeah. I have a 39-year-old or 38-year-old cousin who is, it sounds like is about to start ABA. So it's never too late. So thank you for
Can I
clearing that.
add one thing?
Oh, yes, absolutely. Please.
I'd love to add, we've had a lot of families reach out to our company who have gone through like the center schools that are in Denver and they're 18. And a lot of services at 18, especially with insurance, they just stop. And but these behaviors continue to pop up, right? Because there's this whole young adulthood transition, and that's something like we serve up until 21 because that's what insurance allows us to. And that 18 to 21-year-old transition is brutal. And so it should never stop. Everybody should always be supported.
Yes. Right? Well, and this kind of ties into that our last myth in this regard, that every ABA provider practices the same way. What are our thoughts on that, friends?
Yeah, I mean, I think I can understand again why people might think that, right? Because you think of if you think about other specialized services, you would think like, okay, OT, I know what I'm doing when I'm going to OT, like I'm going to receive some very standard procedures related to how I can increase my mobility or my ability to use a fork well, or whatever it might be. So I can understand why looking from the outside in, you would think like ABA is definitely going to be the same. I think that the biggest thing to think about with ABA is that the science really is rooted in individualism and making sure that we are not applying a cookie cutter intervention to a wide scope of people. We are really serving the individual. We're assessing at the beginning of their treatment to determine where the areas are that we want to increase skills. And we are tailoring a plan for those individuals that is related to their interests, the things that they find reinforcing, the things that work within their family's cultural unit, all the different things that we want to make sure that we're being really cognizant of. And the field of ABA is doing a lot of really great just growth within their practitioners to make sure that we're really focusing on individualization of programming and then also cultural considerations and other things that might impact, somebody's day to day.
Yes, thank you for saying that, because I think it's so critical, right? That there's so much taken into consideration. I love that somebody in the chat said that if you breathe, that's a behavior, right? So everything can be. So I like that. Okay, well, thank you so much, Behavioral Innovations. So coming around to handprint therapies. So Miss Betsy, we have some of the difficult questions for you. So wanting to kind of just start this off, because I truly was ignorant to it as well when I first came into this industry. Why has ABA become controversial?
Such a good question. And I think that really stimulated this conversation. And I may be a little repetitive with my answer, and everyone is speaking so eloquently. And I think it's great, even if I do repeat some things. So some individuals have shared really difficult experiences with ABA. So we've heard that, and we know that this was kind of the older approach. This was years ago, and those old practices really seemed to try to teach individuals to hide who they are or who they were. Trying to stop the behaviors that help them regulate. And somebody already mentioned that with the stimming and the hands. And so the self-soothing, we don't want to stop that. That as an OT, these are behaviors that we want to encourage, and that individualized kind of self-regulation is so important. So old school ABA may have tried to stop that, or could have really encouraged those to comply without having a voice. And so those experiences are real, and ABA has evolved, thank goodness, and we're hearing about that over and over again. We know more than we did 20 to 30 years ago. We've been able to reflect and grow and improve the field. So I do think those experiences, we hear them and they're real. And I think that does add to that controversial kind of feeling.
Totally. Yeah. Well, and this, I'm curious around, we use the term neurodiversity and neurodiversity affirming a lot in this industry. And this kind of piggybacks. So we have a question. So I have a question for you, and then we have a question in the chat. I think we can bridge them. So the question is, what does neurodiversity affirming ABA mean?
Okay.
And why I think this ties in is we have an attendee who is asking if ABA is only for children or people with a formal diagnosis of ASD. So we know neurodiversity encompasses many, just diverse learners in general, right? So ADHD, ADD, it could be all these different things. So yeah, I'm curious if you can kind of bring both of those together.
Absolutely. So I'll start with, what does neurodiversity and affirming ABA actually mean? And I'm going to be pretty short and sweet on that. Again, we're not trying to change who a child is. We embrace individuality. And so neurodiversity affirming ABA really helps children thrive in a way that honors who they are, which happens to be our mission statement. I love that statement. So really, whatever that means, we're supporting and leaning into that individuality, and just affirming each child for who they are. And then your second part was about ABA.
Yes, if it's only for children or people with a formal diagnosis of ASDs.
So at least here in Colorado, we can provide ABA services for children who have Medicaid or a Medicaid waiver that do not have a diagnosis. And I wish that were true across all insurance providers, because ABA works. Like Nicole, I think it was Nicole who said, it's a science. It really works for all children, regardless of a diagnosis. So does that answer? Maybe someone in the chat could piggyback that. If there's more questions about that, I'm happy to address.
Totally. Yeah. Anybody else and want to speak to that briefly? Okay. Perfect. All right. So tell me a little bit, Betsy, about how do you balance teaching skills while also respecting autonomy?
Aha. Okay. So we don't stop teaching the hard stuff. They are difficult skills that we're teaching, but it's really about how we teach those skills. Collaborative, meaningful, choosing the skills that actually really matter to the child. So while we respect a child's individuality and their preferences and their communication styles, we're still working on developing those skills, but doing it in such a collaborative, meaningful way so that it does feel reinforcing and positive. So,
love it.
And of course, respecting that autonomy and really encouraging the communication, whether it's through using their AC devices or watching behaviors. There's lots of verbal cues that we pick up on. So we're really respecting that autonomy along the way.
So important. Oh my goodness. I imagine that's huge, even for like adults, right? The buy-in and just feeling like, hey, I'm still an individual. So we have somebody who put in the chat, they put it in the Q&A and the chat, and they really want to hear your thoughts, Betsy. So since we're on you. So if an autistic adult is seeking out ABA as a resource, how would that be different from an autistic adult seeking out, say, traditional therapy like CBT or DBT?
I'm so sorry. Can you break that down a little bit more for me?
Yeah, absolutely. So it sounds like, so for an autistic adult, if they were like, should I go the traditional mental health therapy route, right? So CBT, DBT, just traditional talk therapy, if you will, or should I go for ABA? How do they, cognitive behavioral, yes, like how would they?
Gosh, that's a really good question. And I might recruit some of our groups that work more with adults, given that I'm more focused on the pediatric 0 to 18. I would love to hear some of our adult providers answer.
I can jump in, Betsy.
Thank you, Romina.
Of course. I'm actually currently working with adults. The process is definitely the same where they would go and reach out to their primary, and then they would get a referral. And once we receive that referral, we do an assessment. The assessment does look different from a child or elementary age client, but we would still run a skill assessment, and we will also do an interview. If it's the adult, and they want to be part of the interview, or if they want to be the one completing the interview, we do the interview and we talk about which behaviors they would like to increase, which behaviors they would like to decrease, what supports do they need. I work with individuals who may need self-regulation support at work, not being able to handle their boss giving them feedback, or the social aspect of having coworkers. So we really dive in during that interview to find goals that are meaningful to them, and that will be applicable to make their lives better. So the process is just getting that referral, having an assessment, and then doing that assessment based on the results. That's when we would prescribe a specific amount of weekly hours, which will have a direct therapist that would come into the home or go into the community. Like we mentioned, we do provide services at school as well. In California, we actually have a program where we go to college with adults, which is really neat. So it will be the same, but just more specific to what the support of that adult may need. But we need a referral from a primary or a psychologist.
Okay. So that's what I'm really hearing, that it sounds like in this regard, an individual may receive a referral from their therapist or from their doctor in that kind of regard. And then the assessment. So I imagine the assessment is different, because to my understanding with traditional CBT and DBT, there's not always that's not always parallel, right? They're not always going to do an assessment. So thank you for that. That was perfect. Thank you, Romina, for chiming in.
Of course.
Betsy, coming back to you, I'm curious, how do providers decide when to not work on a behavior?
Well, and again, I want to thank Romina. That's the beauty of a panel, right? We all specialize in different aspects. So thank you, Romina. So how to decide what behavior to work on or what behaviors to not work on. Yes. So again, not every behavior has to change. So recognizing that we want to focus on safety first, safety to self, safety to others. And then looking at behaviors, does a behavior interfere with learning or participation? So if yes, that could be a behavior that we would want to address. Is a behavior causing significant distress? That would be another priority to work on. And then really listening to caregivers too. What behaviors are really interfering at home or out in the community? What priorities do our caregivers have? And I think that is such an important piece of developing a treatment plan that matters. And recognizing that, again, will look very different for different families. So it's, again, not a one size fits all. That caregiver input and that intake and recognizing as a team, and I've got to do that little shout out for including speech, PT, and OT, how important that is to really bring the professionals together. And when that interdisciplinary approach is done really well, it's like magic. It really is. It's bringing in the communication expertise of a speech therapist with their AAC or other means of communication, plus the OT with their sensory background, recognizing the recommendations that they have that the RBTs and the BCBAs can continue throughout their day. So that could be a whole different webinar, but I'll stop there.
And that is something, a plug for you, Betsy, man. I feel like you are becoming the not the queen, but maybe the goddess of putting on these webinars and talking about ABA. So that's your next one. For those who cannot see the chat and who may be watching this as a replay, I just wanted to read also Jasmine with Achieve ABA's response too about kind of what's that difference between going with ABA versus traditional therapy. An autistic adult seeking ABA may be looking for support with specific practical skills. So that's kind of what's sticking out is the skill aspect. So that could be communication, independent living, workplace, routines, safety, like you were just talking about, Betsy, or navigating daily activities. So ABA typically focuses on how the environment affects behavior and how skills can be taught and practiced in real life settings. So that real application. Whereas when we think of therapy, like CBT or DBT, that more directly addresses like thoughts, emotions, things, anxieties, trauma, coping strategies, relationships. So just to kind of have that specific write-up. So thank you so much for that. Well, we're going to move over to Allure Behavioral Health. So Romina and Alden. We want to go over some parent scenarios. So I know we have some parents and caregivers on this, and obviously who will be watching this. And some of them may be like, well, what would this like? What does this look like in action, right? So if ABA is all about building skills, what are these? So either Alden or Romina, the first scenario we're going to kind of throw out there is a 4-year-old melts down every morning getting dressed. And my goodness, I'm sure there are parents out there who are like, yes, that's my life. So yeah, how would you address and like approach that?
Sure. I have a 5-year-old, so I definitely can relate to this scenario. One thing I do want to repeat what Jasmine said earlier, behavior is communication. So when I hear this from a parent, the first thing I want to do is observe the whole event. And then I want to answer some question. Is the child tired? Are they being rushed? Is there sensory sensitivity to fabric? My daughter does not stand tags, so I don't purchase anything with tags. So really understanding that part, and also understanding, are they able to make a choice in their clothing? My daughter is very particular about what type of clothes she wears. So we also want to make sure that we're answering that question as well. The other questions I may ask myself is the routine unpredictable? Are we waking up at the same time? Is there an alarm that's being set? Who's waking up the child? Is that consistent across the week? The other thing I want to see is what steps are they independent with during that routine as well. Once I'm able to kind of answer the questions, and I want to kind of create a plan. If it's a lack of communication, then we want to make sure we're teaching them, help me, or this hurts, or I need a break. I'm tired. So making sure that we're filling in whatever skill deficit there are in terms of communication. If I observe that it's a sensory issue, then we look at the different fabrics that we can purchase. Or usually parents are amazing at this. Is there a fabric that you see them tolerate more than another? So we want to answer that question and remedy that issue as well. The other thing I want to look at is maybe creating a visual schedule. If there's not a consistent time that the child has been waking up, let's set a routine. Let's have them wake up at a specific time. Adding a visual is also awesome for any child. Another thing that you can do also to kind of make the routine more predictable and giving them choices is laying out clothes the night before. So you give them that choice. There's less rush. You have more time at bedtime. It can become part of the bedtime routine. Do you want to wear a red shirt? Do you want to wear a pink shirt? We do have clients that are very specific in terms of the colors they like, the type of clothing that they like. So if you do that the night before, then you're kind of taking that out of the equation in the morning. Another also a simple solution could be if we're waking up, let's say an hour before we have to be out of the door, let's add 15 to 30 minutes to that. So let's change the time that we're waking up the child in question. Sometimes kiddos may need more time to just kind of wake up. So giving them a hug first thing instead of a demand immediately as they're opening their eyes. So, but that really starts with me observing the whole routine and then answering some questions and then creating a plan based on the observation.
Love it. And then same thing with, and we kind of have already touched on this when we talked about stimming and things like that, but if a child hand flaps when excited, would you target that behavior? Why or why not? And I'm seeing a lot of heads.
Absolutely not. I remember as a BT, and I was very young, I was 19, and just became obsessed with the field after rescuing a little boy that actually escaped and was wandering. And when I first started working in the field, I remember seeing hand flapping. And honestly, and this was 2006, right? There was a lot of taboo still around the diagnosis of autism. It was a lot of parents being concerned about their child being judged, someone making fun of them, someone staring at them at the grocery store. So it never came out of malice, just based on my experience. It was always families trying to make sure that their child was not made fun of or that they didn't stand out. Now, over time, I did my own research and my own training in terms of ableism, assent based, and I've learned to kind of advocate now for clients when you have a family that say they hand flap and I don't want them to do that. So that I take that opportunity to talk about how different they are and how that makes them their own unique person, and how hand flapping can be something that their body needs, and really trying to change the minds of the parents or the people staring. I always tell families, like, I'll go to the grocery store with you. If anyone stares, I'll be like, hey, do you have a question? So like really empowering the families, and really empowering the fact that these children and all children are unique and they have specific needs. Hand flapping doesn't cause any harm. Usually they're able to still participate in the activity, so it's not interfering with learning. It doesn't hurt anyone else in the environment. So that's definitely something that we would not work on.
Great. Great. Love hearing it. Yeah, it was amazing to watch all your heads go, no. So
Well, we
parents,
did work on that back in the day, so that's a really fair question.
well, and one that even so having worked in admissions in the past, I've definitely seen this one where parents disagree about goals. So and I'm sure that we've all seen that or maybe experienced that. So maybe one wants independence, the other clients. How do you navigate that?
I definitely think for me, at least the way that I like to practice is I like to make the parents be part of the treatment plan. I would never implement a goal that a parent or a caregiver or anyone in the environment did not agree upon, unless, it was safety and, caused harm to others or themselves, then obviously it would be a different conversation. But when it comes to independence and compliance, I first like to talk to parents about what does compliance mean to you, and how would you define it, and what does independence mean to you? Because there are certain things that would be applicable and certain things that they wouldn't, right? So if we have kiddos that wanted, let's say the example of the morning routine, they want to be able to complete all the tasks, but it takes them longer, right? So it takes them longer. So then that means that there's a skill deficit. Let's spend more time, not in the morning, right? The day before, the night before, really working on them becoming more fluent with that task so that they can have that independence. And I think that's something that's great, right? I struggle with that too. Like, I think 2-3 years old, where they're like, my turn, I do it. Like, oh, we've all been in that phase. And I think it's a really good thing to foster and really make sure that we're shaping when it's something that's positive and that can lead to them becoming independent in other skills. Now, when it comes to compliance, I like to talk to parents about, let's talk about what's negotiable and what's a non-negotiable. Like, you have to go to school, that's a non-negotiable. You have to brush your teeth, that's a non-negotiable. Do you have to eat, and that could be controversial, but do you have to eat breakfast, or I mean, like breakfast food at breakfast? In my opinion, that's a negotiable. I think that if it's something that's nutritious, it's something that they like, it's something that they're going to finish in, within the time period that you need them to, I think that's something that I can talk to parents about. That's a negotiable task, right? We can make choices, we can agree on what would be approved to eat for breakfast, and giving them more of that flexibility. So I would approach it in that way where it's not black and white, but let's talk about the grays and let's make sure that everyone is getting what they need. So if the child wants more independence, let's work on that. If the parent is like, I want this to be done in a specific way, then let's be a little bit more flexible. And I like to split them into something that we can negotiate with the child, so they feel like they have some control, which, by the way, is supposed to be a fifth function, and I totally am supportive of that. And then the other that are non-negotiable, so that the child understand that these are tasks or steps or events that have to happen, and there's no way around that. But how can we still support them? So is it communication? Is it the place in which you're doing it? Is it the plate? So if I have to eat this, can I choose the color of my plate? If I have to wear this, can I choose, the day before? So really embedding a lot of the choices, and really teaching flexibility on the caregiver side and also on the client side.
Awesome. I love that. Thank you. And just very briefly, this is something that we hear a lot about in this field, but, kiddos who refuse to transition away from a preferred activity. I know some adults even who might struggle with that. So tell me a little bit, walk me kind of through the thought process around that.
So it would go back to also building predictability, communication support, flexibility, and also trust. And I think one thing that we can all agree as providers that the first couple of sessions are just building rapport, where we're following the child, we're joining in, whatever they say go, unless it's unsafe, of course. But we really want to do that so we build trust. If you trust someone, then you're more likely to follow and be cooperative in terms of what the activity that's being asked to do. So we definitely want to make sure that the trust is established. Now, when it comes to providing that support, I would look into, do we need to teach functional communication? What is the issue? So going back to the first example, I would want to observe that transition. So I can really look at what are the antecedents, what are the behaviors, what's happening in terms of what's being provided as a consequence before creating a plan. But it will all fall under supporting whatever skill deficit there are, making sure we're teaching what the child needs to do, but also, incorporating that flexibility training as well. And predictability, visuals are really amazing. Having a visual schedule, having a schedule in general, which helps with them being able to know what's coming next. But what we also talked about earlier is assent, right? If it's something that's negotiable and the child is not providing assent, then it's something that does not need to happen. So it would just stop and the transition will not happen. Now, when it comes to a non-negotiable, that's when we come into, okay, how do we make sure we give them all the skills that they need to ensure that they are able to wake up, going to school, going to a doctor's office, going to a dentist office. So really thinking of what is optional and what's not optional, and making sure we're filling in all the skill deficits.
Great. That is super, super helpful. So transitioning over to how parents should choose an ABA provider. And we already had somebody in the chat asking about this. So this is going to be your section because we're going to actually answer just about every one of those questions you asked. So coming back around to Achieve, what questions should parents ask during an intake?
Maddie, you want me to take this one?
Yes, go nuts.
Okay. Okay, so there's a lot of questions that, a parent should be asking, like, what will a typical session look like for my child, right? Like have them like walk you through, like, obviously it's going to be very, very individualized, very different, but, just to see like how that provider, how that company works, right? Who will actually be working with my child? How are they supervised? How often will I see the BCBA? That's a really big one, right? How will you arrive at how did you arrive at the recommended hours? Hours are always individualized. You don't want to just have like the, kind of a little background. I used to work at a clinic where they only did 20, 40 hours. And so you kind of want to stray from those types of uh, places that they don't have individualized hours. They only have two different options or that's it, right? How will I, as a parent, be involved? You know, you want to look for that real parent collaboration. And I don't like to use the word parent training because we're not training you to be parents. We're collaborating with you, right? And so, and not just have it be like a monthly call. You know, you want to be very involved. How did you choose these goals? Like, how are you going to run them? You know, like, what are the types of like, you know, like for us, we have to write teaching procedures for each skill acquisition goal, each replacement behavior goal, right? And so like asking them, how is that going to like look like? How are you going to teach my child that? What does progress look like? And how will I see the data? You know, and I like to tell parents, you know, you may not see a lot of progress within the first 6 months. You know, they're still getting used to these services. You know, again, it depends on the individual child or, you know, adolescent, adult, but I usually start seeing a lot of progress after the 6 month mark, right? And so, and how will I be able to see the data? You know, like being able to ask for those reports that we turn into insurances, being able to maybe have some printouts or have some, you know, like updates on the graphs on progress from the BCBA. And how are you going to handle if my child says no? You know, going back into assent-based care. How are you going to handle it, right? And so this answer is really going to tell you everything about how the provider thinks about assent and autonomy. And you know, you want your child to have both, right? And so those are really, there's a lot of questions, but those are like the first few questions you should be asking the provider.
Super helpful.
And I want to jump in and say it's also a feeling, right? Like when I see Betsy, I know I want to be in this woman's life. And she's warm and welcoming, like all of you. And as a mom of two children, you really want that. You need to feel that connection with a provider. This is somebody who's going to be integrated into your life and is meant to enhance your life and your relationship with your child, as well as provide these services. And so if it's not feeling like that gets a good fit, that's okay. You can move on to another company and make that choice for your child. And that's just so important to know that as a parent, ultimately you are number one here. And providers are here to support you and support your child and support your relationship with them.
Oh, I'm so grateful that you said that about it's like even getting a second opinion, right? You can always get a second opinion. You can always change providers. It doesn't always have to be because of a big negative incident, right? So I appreciate you saying that as well. And speaking of Betsy with handprints, tell us what are some green flags? So we just kind of talked about different things to discuss in the intake. What would be some green flags that this ABA provider is the right fit for my family?
I love that I got the green flag question, and Maddie, right back at you. And it really is about feeling. So I'll speak to, I know we're kind of skipping a little bit the step about deciding between home-based versus clinic-based. There's a whole other webinar on that, because once we learn about ABA, then it's that discussion about, okay, what's best for my child? And there's a whole other kind of decision tree associated with that. So I'll start with a clinic-based green flags. And then maybe if anybody wants to speak to home-based green flags, I would love to recruit support there. So from a clinic perspective, if you are deciding that clinic-based is really what my kiddo needs, I recommend showing up early for your tour. So sit in the waiting room, feel it, feel the vibe. And you can get so much just from being there and watching. Is there somebody at the front desk? What about all the other caregivers in the room? How does it look when a therapist comes out to greet another child? Just kind of getting that feel like, is there connection? Is there respect? So you'll get a lot just by sitting there, and waiting rooms are open. So hop in anytime. And I really think the more time that you can spend in a clinic can really help you solidify that feeling. The other thing is when you tour, so I definitely recommend at least 1, 2, even 3 tours. because of different clinics, because every clinic has a different vibe. There's a different culture. And even within organizations, there's different cultures. So I mentioned earlier, we have two clinics, one in Lakewood, one in Greenwood Village, and they both have different feelings. So you really can get a lot just by being there and looking at the space through the eyes of your child and observing what's happening when you're on your tour. How is the staff interacting with each other? Are they showing respect to one another? Do they look like they're enjoying their job? It won't look that way all the time. It's a hard job, but you'll get that feeling just by walking through. Is there a sense of respect and collaboration? Are the therapists on the floor, eye level? Are they getting down and really interacting and saying, we can say what we say on these webinars, assent based, but to get in there and really observe, is this compassionate, collaborative interactions? So those are the green flags. I'm just going to keep it at that. And I love how Achieve, Jasmine and Maddie, your questions were not yes, no questions. They were how, or tell me about this. And so even if you know those answers ahead of time, integrate those into your tour. Like, how do you develop your goals? Like, whoever's giving you the tour, it doesn't matter who it is, if it's a leader or a BC, it doesn't matter. They should be able to talk with you about that. And how do you collaborate with other professionals? I would say don't ask, do you collaborate? Because of course that question will be yes. But how? How do you do it? How often? Really get those questions answered and be part of the tour. So those are the green flags.
That's great.
That I can.
Home.
Say that again.
I'd love to add the in-home and in community flags to piggyback off of what Betsy just said. It's like the feeling of coming in. I feel like when you go to your child's classroom, you're going to know in 10 seconds if that teacher is going to be a good fit. And it's like having BetterHelp therapy online virtually. You can kind of like Tinder swipe date these therapists until you get the right fit. That's okay to do. And it's all about looking for the green flags and the red flags and the feeling of, okay, if this person is going to be with me and my child consistently, are we all going to feel good? And the biggest thing that I wanted to piggyback off of Betsy was that when you are going into these centers, we're all trained to work in this field. And it's like being a doctor. There's a lot of jargon and there are a lot of things that you have never been, as a parent, have never been trained in understanding this wide range of therapies and teaching and blah, 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 blah. So there are a lot of advocates in Colorado, and you can always contact all of the amazing advocacy groups and say, this is what I'm going through. Will you go on this tour with me? Will you look at all of these providers with me? Will you speak to this group with me or a teacher with me? And those are nonprofit resources that families sometimes don't know about, but they are there to support you in finding the right services. And they are all a green flag that we should all take advantage of.
Totally. Yeah. I think it's sometimes easier to find those red flags, right? So I appreciate that we looked at green flags too. So Ramina, for Alora, I'm curious. So this is a twofer actually. Just quickly, what are some red flags? I feel like we've already kind of touched on this, but what are some red flags that parents should look out for?
Sure. And I'll try my best to list the one that we haven't yet. So I would say if you're not allowed to observe the session, that's a huge red flag. There should never be an instant where a client is with the therapist in a room and the door is closed. We really want to encourage parents' involvement, sibling involvement, caregiver. Everything is focused on compliance. So usually I've seen goals and, we've all been there. Compliance at 100%, compliance at 90%. I'm not compliant 100% of the time. So definitely making sure you're aware of how the goals are written. The child is always distressed when the therapist walks into a home or when you're doing the greeting at a center base. I believe that the rapport phase is so important for that. But if it's been 6 months and the child is still like running out the door when Sylvia is at the door, then that's an issue. Or if you're dropping off at the center and it's been that long, then that's something that I would ask questions about. Parent collaboration rarely happens. Like you are not aware of when was the last report that was written, what goals have been mastered, how they're doing in terms of the target behaviors. Things are not changing. They're working on the same goal, and it's been 3 months, 4 months, and you're either seeing the skill and you're like, why are we still working on that? Or you're not seeing progress, then there should have been a change. And they're not answering questions. I think if a provider, even the difficult ones, I've had so many questions that, and it's okay for them to say, I'm not sure, let me get back to you, let me get more information. But just saying things like, oh, no, it's okay, just trust us, don't worry, I would say that would be a red flag. And if you're feeling judged as a parent, or if you feel like the goals that are set for you or the goals that are set for your client or your child makes you feel judged or uncomfortable or not supported, then I would say that's a huge red flag as well.
Totally. Yes, definitely. And so this one kind of goes, I'm actually going to group the next two, and any of you can kind of chime in on this, but how involved should parents be? And I feel like we've kind of talked about that, obviously, right? Like, especially with our younger kiddos, very involved. So how involved should they be, and how important is provider family fit?
I can speak for in-home. I've done now at this point, I've done in-home, I've done school, I've done center-based. I would speak for in-home. I would say the first couple of session, it's okay for parents to kind of step back a little if the child tolerates it. We do have children or clients or individuals where they need that caregiver nearby. That's totally fine. But as the therapy moves on, there should be more collaboration. I think especially like Jasmine mentioned, when the BCB is in the home, they should have a conversation with you. If the BCB is in the home and they're not asking, how are things? How was last week? How was this last event? Or if you know that the child had a dentist appointment and that's something that's been difficult, they should be able to ask you, how have things been, and spend that time with you, spend some time discussing the goals that you have set together for that parent specifically. And beyond the BCBA being in the home, I definitely like to make the therapist and empower them to ask the therapist to have family join in on specific tasks. The self-help are amazing because when we're not home, the child still needs to brush their teeth, right? When you're working on matching, maybe not the parent may not sit with them and say, let's work on matching. But brushing teeth, self-care, eating, transition, all the things that I know can be difficult for the caregiver, I really encourage families to be involved, even if it's just sitting back and observing. What is the reinforcement that's provided? What are the visual supports that are provided? What are the prompts that the therapist is utilizing at the moment? I definitely encourage parents if they can, because I do know that families may have full-time jobs, they may have children, they may have other commitments, but as much as they can to observe and be part of it, and even to say, hey, let me try. You just did it. I just watched you. I want to try. And then having that collaboration at that moment. So in my opinion, I think the more, the better.
Totally. Absolutely agree. And I'm sure that's true across the board with most modalities, right? Trying to help our kids and young adults. You just touched on something that is actually a question in the chat that I want to touch upon. This individual says, how can anybody keep a job and help their kids? And I think to your point, this is kind of to all of you. How does one exactly, so if there is 40 hours of ABA and you are a parent, like how are parents doing this?
For me personally, I like to ask the family. I think a lot of times we don't want to make assumption. And then I know working in clinics, it can be more difficult, depending on the provider. The commitment may be different. But I know for us in home, a lot of times you're already there, you're already home, so it's a little bit easier. And I also have to work really hard on the therapist feeling empowered to have that communication with the family. Hey, I just see that you got home, or when would you be available to do brushing teeth? So we're giving choices. So kind of the same strategies we use with a client, we want to make sure that we give parents choices, options, and making sure that it doesn't feel like it's a burden. If all you can commit to is 10 minutes because you have to go feed the baby or you have to go jump on a call, then we'll take the 10 minutes, we'll take the 5 minutes. So really having that open communication and making sure that we're not setting goals that are not achievable for the family so that the family doesn't feel like this is a burden, this is not feeling supportive. And that really comes in that interview process and the continuing communication with the provider. So I would say just really communicating what you're able to do and having that provider create goals around that so that we're not kind of forcing all these goals or all these expectations or that may not be achievable for this family.
Awesome. Perfect. Thank you for that. So we're at our final 10 minutes. I know we've been answering a lot of these questions as we go. So thank you so much, everybody who's been chatting with us and sending in questions. So definitely, if you have a question you haven't asked yet, get that in for the last 10 minutes. So this next question, I hear from parents like me all the time saying public school is not serving their kids. Which we can unfortunately have a lot of head nods for that. And they are just checking a box. So in Colorado, these families are choosing homeschool. It sounds like this individual is as well. What resources exist for kids that are going to be homeschools? We'll start with that.
I'll give this one a go. I mentioned earlier that Handprints Therapies also has Handprints Academy as part of our program. And I get a lot of questions actually about what is the process when a caregiver recognizes that their public school setting is not optimal for their child. And so, what are the steps that we can take? And that really is, and maybe this person who asked the question has already gone through this, but I'll just kind of summarize: going to your special ed department, working with your IEP team, starting there, and then moving it up the chain. And it's really the district that determines when kiddos need to be considered in another placement. And it is the district that determines which of the facility schools and specialized day programs would be most optimal for that child. So they really try to individualize their placements. So that is just kind of an overview of the chains of what, the chain of command of where to go when you feel like your current placement is not optimal. As far as homeschools, I know there are a lot of resources out there. I can't speak to exactly what they are. I do know that there are many homeschooled kiddos who can consider being part of an ABA clinic space. So there is that option. I don't know if that settles well with you, but a child can be homeschooled and be in an ABA clinic for whatever hours are deemed necessary and beneficial for each child. So that's a start to the answer.
Totally, yes.
To chime in.
Maddie, you want to go for it?
Yeah, and for us as an in-home and in community, I know from personal experience, one of my best friends, her son is receiving ABA services, and they had to pull from a school because he was only allowed to attend the private school if he had a one-on-one. And the expectation was that the ABA was going to be the one-on-one, which was so stressful for the family. And so she just kind of let it all go, pulled her son from the program and said, I need a week to think this through. And, figured it all out, ended up starting with the ABA services as, like, let's take this one step at a time and we're just going to do it at home. And he's doing great having the ABA services in home. And then they're branching into the community so that this now homeschooled child who was in full-time private school just for the summer can now, start to move into parts of the community and do community activities like that they have at the different museums and, camps or whatever.
Awesome. And one other piece too for the homeschooling piece. So on our website, guidingbrightminds.com, we have several providers. They are not maybe ABA providers, but they have put out different resources under the articles section of our website. So free articles about homeschooling tips of either getting started or, there's different scenarios within that that might be helpful for you. If you're not finding what you're looking for, you can always reach out to us at team@guidingbrightminds.com, and we can always reach out to our other providers. So thank you for that, ladies. And I'm curious, so this is for the panelists. Are any of you do you have a community-based provider in Massachusetts? I know that's a long shot, maybe. We have other ABA providers that are not on this. I'm seeing a lot of head no's. So I'll type this directly into the Q&A for this individual. I'm going to give you my direct email address to shoot me an email, and I will send you a few of the providers that we do have in our directory that are in fact in the Boston area. So perfect. And then... So this is a good one. It's just so overwhelming, which, I want to validate that whoever that was that said that this is all just so overwhelming. It is a lot. And that's why we do things like this, right? Because we understand that from, the start to the quote unquote proverbial finish, there is a lot. So this individual is asking, where should parents who don't trust anyone start?
Just start calling the advocacy groups. Call the people. Find the person who is going to take the time to speak with you. And even in your worst state of absolutely freaking out, feeling lost, somebody who empathizes with you and can give you a stepping point. There's not going to be one person that is going to solve the problem or answer the question. It's a team of people, right? We all have companies that do similar things or the same thing, and we all love and support each other. And that's how the community should be. So find the people, just make one phone call, email Eve. She's fantastic. And I'm sure she would point you in the right direction.
I love that someone said join Facebook groups, get recommendations from other parents. Another thought, OT and speech, starting there and joining the sessions. You are welcome to join OT and speech sessions, and that can give you comfort and trust and watching the therapist. So I think that's always a great option to start with.
Absolutely. Wow. Somebody makes a comment. I think this is important to notate. Moms of autistic kids are more unemployed than all other categories. Now, of course, we don't have that source cited, so I don't want to say this is exactly knowledge. And I would agree with you that yes, even in I'm seeing head nods, all of our experience, and I'd be curious how this looks across the span of mental health. That a lot of times these moms of autistic individuals or individuals with challenges, they can't work because of just the high needs of their children. Absolutely true.
Eve, you mentioned earlier.
Oh, go for it.
I just want to recognize how much we have heard from caregivers about how lonely and isolating and frustrating and sad this can feel. And you mentioned earlier, Eve, about the webinars that we've started, and we're actually going to be kicking that off in September to do monthly webinars, because what we've found is we have educational pieces that are great, that kind of attracts our caregivers. And then after we're done, we have caregivers stay on for up to an hour because of that desire to connect and collaborate and recognize, wow, this is really, really hard work. And just kind of speaking to what you're sharing, that it's nice to know you're not alone and this is hard.
It is, yes. So know that whomever it was that asked that, or anybody else on here, you were so not alone.
Yes. Eve, sorry, can I jump in for just a little second?
Please.
So
yes.
I know there's, it's hard to get a job, right? A lot of these parents have difficulty finding employment. I know in California, I can't really speak for other states because I'm still learning the other states right now. But in California, if you're on Medi-Cal, which is Medicaid, right, in California, the regional centers offer in-home supportive services where, you know, again, you have to qualify for it, right? Obviously, if your child is one, they're not going to pay you to take care of your child, right? Because that you are supposed to be with your child. But if your child is school age and you just, they have so many therapies, they have just a lot of needs, right? The regional centers and California itself will pay the parents to stay home to take care of their child. Now, I don't know about other states. I would have to research a bit, and I would, challenge the parents on this webinar a little bit to find those resources as well. I know it's really hard, but there are, resources out there. Again, joining the Facebook groups, asking parents like what they do. I know here, I've had a lot of clients find me particularly, for some reason, in my area here in California, my name is out there in the Facebook groups because I am a huge, I'm a BCBA, but I also give a lot of information to these parents about like, hey, like the IEP, like I'm very knowledgeable in California IEPs. I give them a little bit of advice, obviously saying, I can't speak individually to your child, but ask these questions, right? And so joining these groups are really beneficial, and you can get a lot of information.
Just, and I can hop into for Colorado, if your kiddo's on Medicaid, we have a ton of family CNA programs. And that your kiddo can be on Medicaid without you being on Medicaid. And so I know just off the top of my head, Pasco, Abbey Care, a lot of these companies help families become caregivers. There's different tiers too, dependent on your child's needs. But if you can't work because you're taking care of your child, in Colorado, there are a lot of programs where you can be a paid caregiver.
Yeah. Yeah, clearly it's a lot to navigate. So we commend any parent, any caregiver on this journey. Obviously, take care of yourself as much as you can, as much as, we're spending so much of our time getting our loved ones care. It's also important to focus on ourselves. Well, clearly we could just keep talking about this forever, y'all. This is such an important topic. We've hit our time, but I just want to thank all of you so much for joining us today. I want to thank our panelists. So Allure Behavioral Health, Achieve ABA Therapy Group, Behavioral Innovations, Handprint Therapies. Thank you so much for being willing to have these conversations. If you have additional questions, or if your question didn't get answered for some reason, you can always email us at team@guidingbrightminds.com. And then, of course, you can find these lovely individuals on their websites. We will link their websites into the replay. And then, of course, if you are looking for additional resources for your family, or just free tips and tricks, you can always go to guidingbrightminds.com. So I want to thank you so much for spending this hour and a half with us. We do these monthly, so definitely be on the lookout. And again, thank you so much to everybody who joined us today.